Hi, I'm Lukolic and I'm a physician here at Nanticoke Physicians Network. I'm a gastroenterologist trained in treating patients with GI and liver-related issues. The liver has many functions. It detoxifies chemicals and metabolizes drugs. As it does so, it secretes bile that ends back in the intestine. The liver also makes proteins important for blood clotting and immune system functions, and has a role of metabolizing fats and storage of vitamins. Prevalence of liver disease in the United States, it's estimated that about 30 million people in the United States, or 1 in 10 Americans, have some form of liver disease. For example, there are more than 1 million Americans infected with hepatitis B and 4 million Americans infected with hepatitis C. 20% of Americans who have fatty livers are considered to have what's called non-alcoholic fatty liver disease, not associated with alcohol consumption. Each year, about 21,000 Americans are diagnosed with primary liver cancer, one of the few cancers in the U.S. which is rising. Some types of liver disease, for example infections such as hepatitis C versus metabolic like fatty liver, consist of the following. Hepatitis C, known as the silent epidemic, generally thought to be in the baby boomer generation. Those born between 1945 and 1965 need to be mandatorily tested. Many baby boomers could have gotten infected from contaminated blood and blood products before widespread screening of the blood supply began in 1982 and universal precautions were adopted. Others may have become infected from injecting drugs, even if only once in the past. Still, many baby boomers don't know how or when they were infected. To date, there is no vaccine against hepatitis C, such as there are with hepatitis A and B. However, screening is recommended and treatments are available. Moving on to the non-alcoholic fatty liver disease, certain risk factors such as having type 2 diabetes, high cholesterol, increases the risk of having non-alcoholic fatty liver disease. But by far, the largest problem is obesity. More than 1/3 of Americans, approximately 12.5 million or 17% of children and adolescents are obese. This becomes an emerging epidemic. Non-alcoholic fatty liver disease is the 3rd most common reason in the United States for liver transplants. It can lead to steatohepatitis, or irritation of the liver from chronically elevated levels of fat, and even liver cancer. The United States Preventative Services Task Force recommends screening for hepatitis C virus infection in persons at high risk for infection. The USPSTF, as it's known, also recommends offering one-time screening for hepatitis C infection to adults born between the years of 1945 and 1965, regardless of risks, and hepatitis B for at high-risk populations. Given that the liver also cooperates with other organs in the body for certain processes, it has tremendous overlap with certain conditions. Namely, insulin resistance has been found to be an interplay between diabetes, obesity, non-alcoholic fatty liver disease as well. Abnormal iron deposition in the body, which may also lead to cardiac issues, or autoimmune conditions which may attack the liver and the other organs in the body at the same time. There are many types of liver conditions. Depending on what your doctor suspects, discovering a liver condition affecting you may involve a simple blood test, imaging, or more invasive testing in order to help your doctor better understand and differentiate between liver conditions. Nanticoke can offer diagnosis, treatment, and a comprehensive follow-up of these conditions by a multidisciplinary team of highly skilled primary care physicians, subspecialists, nurse practitioners experienced to identify, treat, and manage liver conditions and related conditions such as bariatric surgery. Please feel free to give us a call at 302-990-3300 or visit our website at nanticoke.org.